This session is nurses' role at health center. I would like to invite all the respected dignitaries for this session. Chairperson for this session, Dr. D.C. Thakur sir, Director, Guru Shri Gorakshnath Chikitsalaya, Gorakhpur. Co-chairperson, Mrs. Lily Joseph ma'am, Nurse Manager, Cleveland Clinic, Florida, USA. Moderator, Miss Susan Dan ma'am, Nursing Tutor, Guru Shri Gorakhnath College of Nursing. Rapporteur, Miss Nana Singh ma'am, Nursing Tutor, Guru Shri Gorakhnath College of Nursing. Technical experts, Mr. Prabhu sir, Mr. Akshay Edward sir. I would like to invite moderator of this session, Miss Susan Dan ma'am, for further proceeding of this session. Ma'am.
A very good evening to one and all. Silence, please. It is time to start our next conference session. Myself, Sosandan, nursing tutor in Guru Shri Gorakhnath College of Nursing, Gorakhpur, and it is a pleasure of mine to moderate this session dedicated to nurses' role at health centers. And it is a pleasure, okay. Along with me, Miss Nana, nursing tutor in Guru Shri Gorakhnath College of Nursing, will join me as a rapporteur in this session. So first of all, it is a great honor for us to have a chairperson of the day, Dr. D.C. Thakur sir, Director Guru Shri Gorakhnath Chikitsalaya, Gorakhpur, UP. A warm welcome to you, sir. I would like to call on stage Dr. Rajendra Bharti, Dean Administration, Mahayogi Gorakhnath University, to facilitate our chairperson. Okay. Senior Army doctor with 33 years of illustrious service in the armed force. He have enthusiastically served on the several professional several professional frontiers as a doctor, healthcare administrator, soldiers, and leader across various non-physiological and difficult terrains and climates. He started his career as a regiment medical officer in the army and grew to hold several distinct posts as commanding officer and other in administrative capacity. Sir also worked as a medical director at Park Nidan Hospital, Sonpat. Also was assistant medical superintendent Bhagwan Mahavir Cancer Hospital and Research Center in Jaipur. He has holding posts as a director and head of the hospital in different places like Barakpur, West Bengal, and Agra, Uri, that is in Jammu Kashmir, and Gwalior, that is Madhya Pradesh. He served as a commanding officer of the only parachute field hospital in the Indian Army. He also holding some awards, that is the Vishish Seva medal, sorry, the Sena medal, the Chief of Army Staff Commendation card, the Vice Chief of Army Staff Commendation card. So we are very honored, sir, to be here. So thank you so much for coming. Uh, Next, it is really an honor to have our distinctive lecturer, Mrs. Lily Joseph, nurse manager. Okay. It is really an honor to have our distinctive lecturer, Mrs. Lily Joseph, nurse manager, Cleveland Clinic, Florida, USA. We are really glad to have you today. On behalf of our institute, I welcome you, ma'am. Now it's my privilege to extend my warm welcome and best wishes to all the people present here. As we forward into the session, I would like to begin the session with the paper presentation by the research scholar. That is, first one is Mrs. Sangeeta, MSc Nursing of Guru Shri Gorakhnath College of Nursing.
Thank you, ma'am, for presentation. Welcome to International Conference after second session. Good afternoon, respected chief guest and my all of you lovely student. Today I presented dietary management of patient with COVID-19 research presentation. मुझे दिख Yes. Okay. Assess uh, assess the knowledge of effectiveness, education, information, modification. Assess the knowledgeable among the staff nurse of during COVID-19 patient. ये मेरे को क्या करते हैं मेरा फोन दो ना Abstract. Respiratory syndrome, the other coronavirus, causes most of the colds that affected during the year but are not a serious threat for otherwise healthy people. There is no way to tell how long the pandemic will continue. December start in 2019, there was an outbreak of pneumonia of generic to disease Wuhan, Hubei, province of China, which affected more than 60 committee informed the World Health Organization who declared pandemic period. कुछ नहीं दिख रहा क्या बहुत सही नहीं चला गया ये मेरा तो काम है वैसे अब नहीं
Actually, our guest lecturer is waiting on online, so she need to join us at 5. So that's why we will give her chance afterward. So now I want to invite Mrs. Lily Joseph, ma'am, to deliver her lecture on topic what is quality assurance in the healthcare. Over to you, ma'am.
Hi everyone, are you able to hear me? Oh, awesome. Thank you so much. First of all, thank you so much for giving me the opportunity. I feel so bad that I came in between and when the other lecturer was actually giving a talk. But again, huge thanks to everyone, especially Ajita and everybody I studied with Ajita during our bachelor program in KMCH. So it was a great honor, and I'm so blessed to have able to share my experience, and I hope that will be helpful for you all. Um, so before I start, I just want to give you a little heads up about myself. I'm not sure whether you can able to share my screen. Let me try. Um, share. Can actually see. I just want to make sure you guys are able to see my screen.
Recording in progress.
Are you able to see my screen? Hello? Are you able to hear me? Yes. Sorry, hold 1 second. I just want to make sure you guys are able to hear me and able to see my screen so I can able to talk. You can, okay, what about the screen? Are you able to see my screen? Okay, now I can see. Okay. What about now? Now, okay, awesome. Okay, please let me know if you guys are not able to see my screen, or then I can able to change it. So anyway, about myself, I just don't want to take you a lot of time because I know you guys started at 4:30, so you might be very tired and sleepy. I really don't know how you guys are able to sit and watch. Hope you had a break too in between. So by the way, I'm Lily. So I'm the currently actually I was actually nurse manager at Cleveland Clinic Martin Health at South Florida. I studied at KMCH Hospital, and I was ICU nurse. Like some of you guys like learning, and then So after I graduated from my BSN degree, I worked in KMCH Hospital for a few years. Then I had a chance. I completed my CGFNS and NCLEX and everything. Then I went into US. When I was in US, actually, you guys might see now that I was able to talk in English and everything, but I was really struggling. I was not really a English medium student. I studied in PSGG Kanya Gurukulam, Coimbatore, and then I just want. It's not like to pride myself. I don't want to really boost myself, but I just want to say the topic is really completely relevant to my life. So after I did my bachelor's during my program time, like you guys are, and now I really learn English a lot to talk and everything. When I went into KMCH, like from KMCH, my base started. That's the way I will say it to you all. Then when I went to US, I was ICU nurse. I was in critical care area. So as you guys think like that, my ambition was ICU nurse, like a nurse, right? Then I understood that when I was actually doing my practice in nursing, I understood there are a lot of things I can do as a nurse according to your passion. Where is your passion is, you can actually elaborate yourself. When I was actually doing my nursing career, I understood my passion is education. That's why I'm doing this like kind of a hobby for me, like to just talk, to hear from you, answer your question. Okay, I love it actually. So when I was doing it, I thought I can be an educator or I can be in nursing leadership role. I chose nursing leadership because it kind of just my team loved me, and I just thought that will really my personality matches for that. So that's why I chose leadership. I was doing, in India we call it as a nursing superintendent. So here we call it as a NOM. NOM means nurse operation manager. So I did something. Like that, excuse me. Then I became a nurse manager. Actually, before that, it was assistant nurse manager. nursing coordinator. Then I became a nurse manager. I did my master's of nursing, also leadership in management. And I got some few honors and roles and everything. The reason why I'm really sharing about myself is nursing is not like kind of a well, so just you are not in that particular place. You can spread yourself, you can spread your wing according to your passion. So I will just detail a little bit more about lot of roles, what as a nurse you can do. Let me see, I can go to the next slide. Okay. So as you all know, that nurses' role in healthcare, the primary role, as you can see, I kind of try to add some pictures. So it kind of just help you to understand it very little bit clearly. So nurses means bedside, and we manage the patient physical need, and our goal is to prevent the illness and will treat the health condition of the patient, right? So that's our primary goal as a nurse. And everywhere, wherever we go, we are a nurses. I can be a nurse manager, I can be a nurse educator, I be a legal nurse, or I can be a case manager. Doesn't matter who you are, basically you are a nurse. So the main primary role of a nurse never changes. It's always like that. And wherever we go, because we kind of chose this profession to spread our wings. Okay, so I just want to make it very clear. The primary role of a nurse is taking care of a patient and meet their needs, okay, to bring up a good outcome. So that's our primary role. The other things, what and all as a nurse we can do. So currently in India, I know that we have educators. So you guys have a lot of educators, mentors surrounded by you. So in a college, you have a lot of opportunities. So when I was in India too, my goal was I want to be a lecturer. Okay, that's it. I want to be a lecturer. I want to teach students. I want to be a mentor. So that was my dream when I was in India. So when I came here in the clinical side, I just felt like we have a lot of roles available. So some of the example I want to share it with you. You may know all these things. You guys might be studying this, but just kind of giving you a little example will be helpful for you for your future when you want to choose your career or spread out your wing. That's the way I would say that. So there are a lot of roles available. But just to kind of like short and sweet, some of the role it's very prevalent in the hospital sites are clinical role or direct care provider. That's the primary nurse. Okay, in so currently, I am in UAE, in United Arabic Emirate, right? So I work in Abu Dhabi Hospital. So my role is charge RN. Okay, so that's one of them. In USA, we call it as RN, otherwise registered nurse. So that's the primary role. The other roles are we can be an educator role. In order to be an educator role, you have to do some of the higher education. Like for example, I can actually choose MSN, like a Masters in Nursing and Education, okay, to be an educator. So I can do that. Or with the leadership, I still can be an educator too. We have nurse advocate role, we have nurse managerial role. So the manager role, as I said, manager role or administration. So this is another different role as a nurse we can do. Case management, this is another one. Lot of my friends chose case management too. It will work it out with their family situation. Those they have a kids, it's from Monday till Friday or something that you can adjust it with a time schedule. So that is case management. Collaborator role, leader role, it's like kind of managerial role, as I said, research role. So one of my friend, that's very kind of prevalent in developing countries. Like so in UAE here, in this hospital, Cleveland Clinic Abu Dhabi, every unit, like every department has an educator. And my friend who came from US with me, she is a nurse researcher. And in research field, like today I met some of the friends. My friend is a research coordinator. My other friends, they are research scholars. So that's kind of something new to me too. I only know that we have nurse researcher, but under the research itself, there are different fields available. But that's kind of cool because she said her passion is research. I can do research a little bit, but not like that's not my passion. But it's beautiful that whomever have the passion, we can choose what we want. There are other areas also available is infection control nurse. The opportunities are less because remember, like in a hospital, we have one or two or three maximum nurses are there, but and also it's hard to study. However, doesn't matter now with the COVID, flu, whatever going on. The hospitals are really looking forward infection control nurse. And we have occupational nurse. And today, like yesterday, and during our orientation, I went and see occupational nurses, and they play a huge role in the hospital setting. Forensic nurse, criminal justice. Oh, that's a beautiful field. If somebody wants to do something like that, it's awesome. So I love that kind of thing because I love to read some adventures novel. So that's my other fashion thing too. Psychiatric nurse, it's another beautiful field. If you guys like psychology, psychiatric, you can be a psychiatric. And we have a lot of mental health nursing field available, so we can be a psychiatric nurse in one of the areas too. um, there is a one more thing is since we talked about psychiatric, I know that when we have some nurses work in a jail or otherwise, in a criminal justice area to take care of those patients. Okay, give me 1 second. I just got the message from her, so I just want to make sure that okay, perfect. Then we have nurse anesthetist. That's under like not my side, okay. But however, I do have nurses. They really like to have that passion. And legal and ethical nurse. One of my friend over here, she's a legal nurse. So it's just really kind of a beautiful field we have here to be an advocate for the patient. And wherever our passions are, we can choose some of the roles. I want to show you something else that this is kind of something to give you an idea between the traditional nursing and modern nursing. I was also like this in our KMCH. Ajita may have some photos just like just to kind of this is the way we dress stuff. We have some cap and everything. It's a traditional system. This is the way we have our hair has to be up, and we kind of go and very sincerely we study. We take care of a patient. This is kind of thing currently in modern world, as you guys see, we focus on what's the special difference mean. We focused on comfort care management coordination, patient education, public health intervention, and it's a transitional care. Okay, so we kind of focus on the patient. Okay, and we study very well, and we kind of do everything with a compassionate care to the patient. That's our traditional way of nursing. In a modern world, otherwise I will say that one in the current world, all the care what we are giving is evidence-based care to focus on how to improve the quality outcome of the patient. So that's kind of something we do. And then we also actually do then all this kind of thing, all our care currently at this the world, okay, is based on the evidence-based practice. Everything you're studying, you're doing, you're talking is all under the evidence-based practice. So, as you know, I kind of transitioned and transferred from United States to UAE, right? So now I really see a lot of stuff. It's kind of like different. It's beautiful. It's just great that because it's all based on current evidence-based practice. For instance, I want to share you something. So yesterday in my class, I learned after the stroke, right? I know one thing is within 4.5 years, I talk a lot. So please make sure that if I'm exceeding the timings, cut me off. So one of the thing I learned is we will do CAT scan or otherwise CT scan when we diagnose a patient as having a stroke, right? So now, along with that, now we are doing MRI here because if a patient is not qualified for TPA, and then we can transfer the patient for thrombectomy if a patient meets that criteria. So if the patient wake up in the morning and we don't know the timings, usually the patient won't meet the criteria for TPA because we don't know what is the last known time, right? But now we can do some of the other interventions and radiological thing so the patient may qualify for thrombectomy and something. So I just thought that's really cool. Okay, so all these things are current evidence-based practice, and then BLS, ACLS, lot of things, lot of changes based on the current evidence-based practice. So currently the modern thing is based on that, and it's really cool, to learn about the new things. Some of this key aspect I want to share it with you is, so we focus on patient care, health education, advocacy. This are kind of something I did actually mention it in my previous slides too. However, we can be a emergency response team. So all these things are focused on some of the aspects, all these roles. So this is the roles I just want to make sure that we do have hospice horror. So hospice or comfort care is not much prevalent in India. However, it's very, very prevalent in USA, in other nations too. Internationally, it's kind of some of the things it's are very famous. So one lot of my friends who really doesn't want to take the stress of the working environment in the hospital setting, they choose this because their passion is to help elderly people who need comfort care or hospice. So kind of something you can choose that too. So another just kind of a role of nurse, we all know that recording the medical history and symptom, collaborating the team to plan for a patient care, advocate for health, then monitoring patient health and record vital signs, administer medication, to know how to do the equipment care, and then diagnostic tests and educate the patient. This is the kind of common role of a nurses. We always study about it, and then you have a lot of key aspects. So all these things are based on the basic aspects of nursing. So these are the stuff I just want to let you guys know. I want to show this picture. The reason is I know that when I studied, during the time we have like few aspect we celebrate, so excellent nurse, okay, and all this thing in the hospital setting. But now, since you have a different nursing roles, you have different things. So like, for example, this is and all in my hospital we have safety hero. So one of the nurse, okay, recognized for safety hero because every day here in this hospital, we kind of celebrate the nurses for their like uh, their immense care, to the patient and then to the unit. Okay, and this particular thing, her name is Shelby. She's my another best coworker over there, and she was recognized for the safety hero. And also we have brain pin celebration for a person who are identifying the stroke. Okay, and this one, just want to show you guys this thing. This is all this thing, including from our president. He is my director. And these are our foundation nurses. And then this is safety coach people. So why I'm showing means, so current at this time period, we have different roles. You choose what you would like to have in future. You are studying now, have your basic knowledge and spread your wings wherever you guys wants to know. We are here with our education, our knowledge, and we will definitely support you all. So I really wish you best of luck for your future, and let us know, like, you have your mentors, your teacher, your educators are there, so let us know your wish and we will guide you. So I was like you one time and actually able to share this thing, mean that is because of all the opportunities I received, and there are a lot of opportunities available. So please use it where your passions are and do it. Hope you're not feeling like this. Thank you so much. If you have any question, please let me know. Anyone have any questions or anything? Anyone have any question? Or can I just stop my presentation and I usually keep in touch
Hello.
with Ajita, so please let me know if you guys have any question to let her know. Then she can always keep in touch with me. And I know Princey also over there. She also studied with me, so I will love to glad to help you guys with my experience and the knowledge I gained for past over a year. So I would love to help you all. I wish you good luck.
Ma'am,
Thank you. Yes, please.
ma'am, I need to ask you one thing. Actually, I have seen your biography in that Masters in Leadership and Management. I think you have done in that. So, can you please tell us, ma'am, what are the specialty or super specialties are there in US? Because we have only five specialties, no, ma'am. That's what.
That's a great question. So, actually, when I was doing my master's, I was actually struggling because in India, when I was there, I know that one master's in med search, psychiatry, community nursing, all this thing, medical surgical nursing, that's and all I kind of know about it. But in US, we have some features like, as I said, like I want to be in a clinical side, right? So I chose masters in leadership and management, so I can be in a clinical side and I can spread my choices to be in a leadership. Like for example, I can be a charge RN, I can be a nurse manager, I can be a nurse director or nursing administration. So all these things covers under the nursing administration, masters in nursing administration, or masters in what I chose, like management and administration. So that is a leadership thing I chose. There are universities, they offer masters in nurse education. My lot of my friends, they chose masters in nurse informatics. That I didn't add it in a slide, but absolutely that is one of the another reputed field also in nursing. So masters in nurse informatics. This is a common thing I want to share it. The reason is most of the colleges in USA, they offer these things. So you can choose a master's in education. I don't know why I forgot it. That's a very, very important one too. So you can be an educator. So you can be in a college just talking about, you can be a professor, you can actually spread yourself, and you can be a clinical educator in the hospital setting. So that is one of the things, masters in education. Leadership, management, masters in leadership, management, administration, that will be under the clinical side. You can be spread your stuff like to be under the leadership side. And masters in informatics, that is for the IT purpose, but you can be like do a research thing, and you can do a lot of thing in informatics too. So that's another masters available, masters program available in USA.
Thank you, ma'am. Thank you for your
You're
valuable
welcome. There
presentation.
are a lot of things. There are a lot of fields out there, but this is kind of some kind of summary I want to share it with you.
Thank you so much, ma'am.
You're welcome. Any other questions anyone has? Thank you all. Again, thank you so much for giving this opportunity. As I said, I would love to share. A lot of people help me. Like they guided me what I want to choose based on my passion. The same way, I would love to help you all or anybody if they have questions or anything. Please let me know. As I said, I know Ajita very well, so let shoot your question to her and she will definitely reach out to me, and she knows how to reach out to me too. And good luck and best wishes for your future career.
Thank you, ma'am, for the time you spent in careful preparation to present us with more needed information on this most needed topic in nursing. Thanks for an excellent presentation, ma'am. Okay. Now, I would like to invite Ms. Achal Gupta to present her presentation.
Is my voice audible to all? Hello, is my voice audible? Okay, I'm sharing my file. Is my screen visible to all of you? Okay, just wait 1 minute. Is my screen visible now? Is my screen visible now? Okay. So, good evening to all the respected teachers and respected dignitaries on the dais. Before starting my topic, I would like to thank the organizing team for taking such a great initiative in Gorakhpur. Moreover, I would like to appreciate Dr. D.S. Ajita Menon for benchmarking the area for the innovative ideas and inculcating a culture of research in the youngsters and young population of presentation is myself, Anchal Gupta. I have been working in Faculty of Nursing, UP Safai, and my topic is a systematic review of artificial intelligence application in the health sciences. So, what is the introduction? Artificial intelligence, as you all are aware, that this topic has been revolutionizing the area and it is transformative development that holds a very great promise for revolutionizing the health care delivery, research, and outcome. AI multidisciplinary computer sciences that concentrate development of systems and algorithms that can estimate human intelligence and decision process. It is essential to examine the topic of artificial intelligence potential because the algorithm that is being used can be used to improve the patient care and increasing efficacy as well as the dilemma associated with delegating responsibilities in various areas as in today's scenario has been marked with the AI field. आपने बहुत सारे ऐसे इंस्टा फेसबुक और काफी जगहों पे देखा होगा कि AI has done doing this. It has shown up particularly various areas. Hello. Okay, 1 minute. Is my slide visible? My slide visible? Okay. Is it visible and audible now? Screen is not visible. Okay. So the problem statement is a systematic review of artificial intelligence and application in the health sciences. The objective of this study is the current study has evaluated the published article with the above mentioned title from 2013 to 2022-23 in order to close the gap and provide an updated thorough analysis of the most recent advancement in artificial intelligence application uses in the health sciences. The research methodology that has been used is PRISMA, Preferred Reporting Item for Systematic Review and Meta-Analysis, that was used to identify the report of various studies. And we have registered this study in under Prospero, and we have taken ethical number from the Prospero itself. The strategic search was started on August 16, 2023. We have started the systematic review with the Scopus, PubMed, and Google Scholar. The keyword that was used in the basis is artificial intelligence, intelligence artificial, AI, machine learning, deep learning, the application, use और utilization, the health sciences, healthcare and healthcare setting. ये सारे words हमने use करके फिर हमने जो भी सिस्टमैटिक रिव्यू के हमें सर्चेस मिल रहे थे, चाहे वो पबमेट में मिले, चाहे वो स्कोपस में मिले, चाहे वो गूगल स्कॉलर में मिले, उसके बेसिस में हमने आर्टिकल आइडेंटिफाई किया था. The eligibility criteria was cross-sectional review, systematic review, scoping review, narrative review. We have included almost everything in the study, like experimental study also included, research article, the meta-analysis. The exclusion criteria for the study were those languages. If our article is being published under some other languages, like other than English, we have not included it. If the entire text is unavailable to us, sometimes it may ask for subscription and all those. So we have not included that one also, and does not include the ethical number. The data extraction and synthesis, the extraction of the data were performed using the inclusion and exclusion criteria. All the information has been independently extracted by the authors. In case all the duplicate information was also deleted. During the review process, the paper, each author opinion was considered. Even in the event of tie, sometimes we have a different opinion कि ये paper ये नहीं ये कुछ और कह रहा है. Some people perspective will be different. So we used to have a tie कि अगर जहाँ पे भी majority का tie आ रहा है कि majority ये बता रही है कि ये paper का perspective यही है, तो we have included that thing into the paper. Every minor detail, including the publication date, the study type, the participant, the characteristic, study objective, and the core concept of artificial intelligence was taken into account. So this is the PRISMA flowchart which we have identified. A total of 10,941 articles we have found, out of which PubMed was 7,811, Scopus was 1,306, Google Scholar is 1,824. Record that was screened is 9643. And only we have included 36 articles. Only we have included 36 articles. Some of the articles were not related to the purpose of the study. Some were the duplicate articles. Some of them we have not found the full text of the article. So those of the things we have excluded out. Results and discussion. See, the algorithm that is used, my study was based on the application. Ki how or what is the boon for it. So the algorithm that is used in the AI is especially the deep learning has shown a marked progress in the image recognition task. अगर हम इसे अपने हॉस्पिटल में अपने गोरखनाथ हॉस्पिटल और अपने हॉस्पिटल्स में इनको इंकॉर्पोरेट करें, दे कैन हैव अ वेरी ग्रेट इम्पैक्ट. इसका oncological recognition, the complex pattern will make it very easier with the advent of the technology. Our chances of getting an error will also be reducing. There are various applications that are several level neural networks such as DNN, CNN, RNN, BEAN, GAN. They are helping in analyzing the long data. Prediction and risk stratification of diabetes is also made easier. I would like to tell software that is Guardian Connect system, which utilizes the patient biometric data. It just utilizes the patient biometric data, and it will alert the patient about the blood glucose control. Even the risk stratification. अगर हमें ये भी पता लगाना है कि 5 से 10 साल में किसी एक नॉन डायबिटिक क्लाइंट को डायबिटीज हो जाए, जिसकी क्या प्रोबेबिलिटी है, वो भी AI से पॉसिबल है. The researchers are also benefited with the AI model. It is not that कि सिर्फ हमारे हॉस्पिटल में इम्पोर्टेंट है. आप AI का आज AI based models के फोन्स आ रहे हैं. Researchers में कई ऐसे technologies हैं, Chat GPT, SciSpace. These are some technologies that are very beneficial for the researchers and the research scholars. Like all of us are known about that mental health issue like depression, autism. These are very difficult to be taught. Means किसी से बात करना है, it is very difficult how to talk with them. तो chat gpt, vmoot, help for moot, these are very helpful in training and screening of the cases. So 70% of the chatbots are based on standalone software. Web chatbots have better perspective of maintaining the privacy. So of technology, the AI technology, easy app is also been characterized. हम जानते हैं कि आईसीयू में हम अपाचे स्कोर यूज करते हैं, रैंसन यूज करते हैं, ग्लासको इमरेज स्कोर यूज करते हैं, जो कि बहुत ही sometimes we may be wrong. So that also can be done with the incorporation of AI, and AI can generate more better ideas. The model used in the radiology, pathology, drug discovery, personalized medication are some of the fields which I am talking that it can reduce the chances of error. Because when we deal with thousands of error, means thousands of data, we have a potentiality that we will be wrong somewhere. We will do something wrong because we are human and we have a chances of error all the time. So the AI can generate much better results. Although the advent has benchmarked the era, as well as it has a potential to change the way we are thinking, it has a negative impact on the workforce environment. As you know कि अगर पैथोलॉजिस्ट का काम भी एआई करने लगा तो उसमें क्या होगा कि वर्कफोर्स का जो environment है, जितना हमें लेबर का कॉस्ट है, वो सब रिड्यूस हो जाएगा. So it has a negative impact on the labor market. The generated result may not be accurate. I would like to quote this line that the generated result may not be accurate because if the algorithm that we are using is biased, so it has a prediction that it will generate the error in the result. Sometimes some of the papers have even characterized the AI as black boxes because we do not know how the generation of the results are basic. So most of the paper, even most of the paper, it has show that how they are means they are arriving to a certain results. The data privacy, the security issue will also rise. Okay, the data will be vulnerable to the cyber attack. Implementation of AI is requires if we are planning to implement AI in our colleges, it requires a huge cost. And it requires a huge cost not in the matter of establishing a system. The internet system, the financial burden will also be a great problem. At last, I would like to conclude that it is a double-sided sword. One side is improving the efficacy in detecting diseases. हम एक साइड तो हमें पता लग रहा है कि disease detect करने में, drug discovery में, it is helping in the clinical decision support system. But the other side is related to the bias in the algorithm. If the data that is being generated is biased, if the algorithm that is the coding is biased, then the data, entire generated data may be wrong. The transparency, data privacy, or potential job displacement. Majority of the tasks will be performed by AI in future. The study recommend the future. For my study, I will recommend that the study should focus on the bias algorithm impact on generation of artificial intelligence result. So these are some of the references which I have taken. Thank you for the presentation. Is there any question? Thank you.
Thank you, ma'am, for the nice presentation. And so now with this, we will conclude our session by extending my hearty thanks to all of you for finding some time to take part in this session. Once again, we are grateful for the experts for their valuable time and the effort you took to share your knowledge and experience with us. Thank you to all. Okay, there is a small tea break. Afterward, again there is a culture program. So students need no one will went out. They need to be here. Okay.